everyone. Happy Wednesday. I'm your host, Shamika Rhymes, and welcome to Celebration. Let me know in the chat where you are watching from and how you're doing this evening. And remember to share this with your network. And if you have any questions at all during the show, drop it in the chat. So let's see. Tonight, we are talking about, and you already see Dr. Anderson here, but tonight we're going to be talking about how to prioritize your oral health. I mean, it's a new year, so it's like new year, new me. Let me do some new goals, pick up some old habits from probably back in the day that you need to be doing anyway. So we're going to talk about that, and we're also going to talk about some practical tips for setting achievable oral hygiene goals, scheduling regular checkups and cleanings, and navigating the rising trend of veneers. Plus, we're going to talk about implants, snap-on smiles, and much more. And of course, again, drop your questions in the chat. And then we're going to also take a look at the risks of dental procedures in non-certified settings and the influence of social media on what you're putting in your mouth, like on your teeth and all those things. We're going to talk about it. So make sure you stay locked in. And let me introduce you to the wonderful Dr. Kim Anderson. She's a graduate of the University of Michigan. And I'm going to tear up the name of this medical college, Meharry.
Meharry Medical
Meharry,
School.
okay, I'm trying to make it
School
fancy.
of Dentistry, yes.
Meharry Medical College
HBCU.
School. Okay, of dentistry. All right. Dr. Anderson has been in practice since 1995. She's the co-owner of Dasling Dentistry right here in Charlotte, North Carolina, and Doby's Bridge Dentistry in South Carolina. So is that Fort Mill or Indian Land?
It's Indian Land / Fort Mill is what they tell us. Okay.
Okay. All right. Well, welcome, Dr. Anderson.
Thanks, Shamika. Can I just say hello to my team?
You can.
I'd like to say, well, and to my family, my husband, Eric McDonald, and my son, Noah McDonald. They're always my biggest supporters. And my amazing partner, Dr. Tiki Swain, and my fabulous team at both Dasling Dentistry and Doby's Bridge Dentistry.
Yes. And I will also say all of them are a great team. I've met a lot of them. So we've got Detroit in the house. We've got Gastonia, and we've got Asheville, North Carolina in the house. So let's kick this off. Why is it so important to set oral hygiene goals? I know it's important to do it anytime, but why, maybe let's kick off the new year, but why is it important?
I think that's a fabulous idea. Just as people set healthcare goals, maybe they want to lose weight or get fit or save money. Having a goal to improve oral health is a fantastic thing to do, especially at the beginning of the year. We see lots of people that come in with their new dental benefits because usually, benefits start over in January. And that's a wonderful time to come in, see us, create a plan for not just that year, but to have good oral health for the rest of your life.
Absolutely. So what are some practical steps that people can take to improve their oral health this year? I know, like you said, people should be checking their benefits to see what they can afford before they just be like, I want a whole new mouth.
Well, we do see that, people come in and sometimes that's what's necessary.
Yeah.
But yeah, know what your benefits are. A lot of people feel like maybe they can't go to the dentist unless they have dental insurance. That's not true. We try to make it affordable for everyone. Yeah, you might have to do some outside financing, but it's kind of like buying a car or a big television or something like that. You invest in yourself and your dental health, and then you get to reap the rewards over a lifetime.
Well, let's talk about that, because I have heard that a lot, that sometimes people are like, I need to go to the dentist, but I can't afford it. And maybe they don't have the credit to do financing.
That could be an issue too. We actually have an in-house plan, and a lot of dentists do these days, where they offer discounts, kind of like a subscription. Everybody's used to subscribing for various things. And so it's like a yearly fee, similar to what a dental insurance plan is. And it gives you a discount for that entire year to get your dental treatment done.
Okay. So what would be the first step for someone that's wanting to take control of their oral health? Once they've checked their benefits, they know what they can, and or they've checked their bank account, whichever one. What what is the next step? How do they go about like
Well,
finding the right dentist?
absolutely. I would suggest, to talk to your friends, talk to your coworkers, who do they go to? Are they happy with them? And then, these days it's very easy to do research, I don't know, Google reviews or, they can be good and, maybe not so much. We really strive to, when people come to us for the first time, we really try to spend a lot of time during that new patient appointment, because it's an interview. The patient's interviewing us. We're trying to make sure that we can assess what the person's needs are, and then it's about creating a plan that the patient understands. And I really want to stress that if you go somewhere or come to me or my partner, or any dentist, you should really be able to ask all of your questions and really get them answered in a way that you understand. Okay. And I know that's what we strive to do. And I think a lot of my colleagues want to do that too. It's harder to do when people just drop in when something's hurting, though. You want to
Right.
try to get in front of that
Hmm.
and develop a plan before you have pain, because it's easier to manage when it's not an emergency.
Absolutely. So, what about those that they're like, I know I need to go to the dentist, but
Yeah.
I got to take this one over here to soccer practice. I got to take this one to cheerleading, and I got work, and
Yeah.
I got to cook, and I got a husband, and I got this, a wife, like all the things, and they're just busy. So, how can they fit those routine dental visits in?
Well, I think we all have that,
Yeah.
and I guess it's about trying to prioritize.
Hmm.
I see lots of busy moms and they get their calendars out and they're taking kids to various activities. I was one of those moms too
Hmm.
when my kid before he went to college. So, it's not an easy thing to do, but if you don't prioritize your health, there's a consequence to that.
Yeah.
If you can't get in and have your routine treatment done and maintenance visits, it gets to be a real challenge trying to keep people healthy if they're not doing their part.
Right. Uh-huh. Let's see. I see some more people in the chat. They're all saying hello, Dr. Kim.
Hey!
You guys make sure you drop your questions in the chat and we'll try to get to those. But are there some common misconceptions about what constitutes good oral hygiene? Because some people could think, oh, all I need is some mouthwash and I'm good. Or they could think, I bought this specific toothpaste I saw on TikTok and I'm good. We'll get to
Right.
the TikTok
Yeah.
stuff later, but
Right.
those examples. But what are some other misconceptions that you've heard of?
Well, there are a lot of products that are available that people think will provide them good oral health, and they do not. Okay. So I have a lot of people come in and they'll say, oh, well, I use the dental picks and those kinds of things. We
Oh
don't like those.
yeah.
We like string, or people who just use water picks and don't do anything else. That becomes a problem, and people who don't have good technique, if you're not brushing properly and for the right
Mhm,
period of time, then you might not be doing the preventive at home that you think you are. And
mhm,
that's why when people come in, we show them the proper way to use their toothbrush, the proper way to use their floss, what works better than those little picker things. There are
mhm,
some things that we can talk about that are alternative than string, but I think the string just works best. I know people don't like it because it's kind of, you have to get your fingers in there and everything, but that's the best thing to do to disturb the bacteria that cause disease.
now does it matter which kind of floss? Because I like the wider one, but there's also the smaller string. Like which one? Does it matter which one as long as you're
Well,
using one of them?
whatever fits between your teeth.
Okay.
I'm not going to be, picky about, what kind they do as long as they do it. That's probably the thing that most people don't do that could make a really big difference in their oral health. And of course, coming in regularly. I mean, that, you do what you can at home, but then there may be some areas that are difficult for you to get to, and that's where you need professional help. And one thing that people are buying a lot now too, they are like buying uh dental instruments off of Amazon. And yeah, it's like a real
What?
thing. And yeah, they're trying to like similar to the kinds of things that we use. I would not suggest that. You could hurt yourself. And hygienists trained for several years to be able to care for
Mhm.
your gums and teeth. And so for you to buy something off of Amazon and then just go to start using it, that's probably not a good idea.
I had no idea. I mean, I think I'm a
Yeah.
dentist sometimes, but I would never, never.
Right. Well, I mean, I see that people are doing that.
Yeah, we have a question from Christina or Christine. I'm probably messing your name up. I'm so sorry, but she wants to know: Are over-the-counter whiteners safe?
Over-the-counter whiteners are pretty safe. I mean, from most of the big companies, Crest, Colgate, they all offer over-the-counter products. Those are pretty safe if you use them properly, follow the
Mhm.
directions, and you should probably also see your dentist just to make sure there's nothing um, that can hurt you if you use one of those products. Like if you have gum disease and you go to put the bleach in there, that's probably not a good idea. So
Yeah.
you want to make sure your mouth is disease free. The thing about the over the counter whiteners is they don't have the active ingredient to whiten the teeth is pretty low. Okay. What we use in our office is
Mhm.
stronger. It's in office. Somebody has to monitor it. It will it's caustic if you don't use it properly. And so we're specially trained. Our assistants are specially trained to do it, and you're monitored while the material is on your teeth. The stuff you buy over the counter, it won't hurt you necessarily, but it's probably not a good idea to use it if you don't have a healthy mouth.
Okay. So, what should people know? Because I think you and I talked about this one day, and I had no idea people were doing this. But what should people know before they are thinking about traveling abroad for dental work? Now, I've heard about people traveling for other cosmetic surgeries,
Right.
but dental, I had no idea about dental work. But so, what are the pros and cons if somebody's thinking, I'm going to go over here to this country because it's cheaper to get
Right.
like veneers or whatever it is they want to get done?
Okay, well, it's called medical tourism or dental tourism, and
Mhm.
we have lots of patients who want to save money, or they think they're saving money by traveling abroad. Well, first of all, I just want to say that there's nothing against foreign dentists. Dentistry in other countries. I mean, I wouldn't. I wouldn't want people to think that the only place you can get good dentistry is the U.S.
Right.
That's not
Yeah.
the case. Okay, first of all. But the issue is that sometimes when you go to other countries, their rules and regulations are different than what we have here in the United States. And
Yeah.
I'll speak specifically to North Carolina and South Carolina because those are the states that I'm licensed to practice dentistry. There is a oversight that they may not have in other countries, and it may not be an issue unless you have a problem. And we all know that problems occur sometimes. That just it is what it is. Any dentist
Mhm.
that would tell you, "Oh, I never have something that that's happened that's unplanned," they're lying. It happens, and so sometimes you have to revise something or fix something. If
Mhm.
you've traveled to the Dominican Republic and had all your dentistry done, it may not be so easy to go back to the Dominican Republic to
Right.
get something fixed. Okay, and
Mhm.
so that becomes kind of a challenge. And sometimes when people travel abroad. I have one case that was probably the saddest situation I ever saw. A gentleman who had some implants placed in a foreign country, and I couldn't use any of them. He basically would have had to have all of them retrieved and the
Mhm.
whole case done over again. And this guy had been through a lot. He had lost his teeth from a baseball accident when he
Mhm.
was a teenager, and he never smiled. And it was really sad to see him come back from the Dominican, and basically I'm like, there's nothing I can do.
Mhm.
I can't utilize any of these fixtures that this man put in your mouth. And so, that's probably a worst case scenario right
Mhm.
there. Um, But when people go abroad, I wish them luck, and I tell them if they need me, then
Yeah.
we're here for it,
Mhm.
but it gets to be challenging to try to repair something that someone else did. Usually you're starting from scratch and doing everything
Mhm.
over again.
Wow. I had no idea that it could be that intense. So I'm just curious, in that case, did you have to remove like all of it, or you just said maybe you should go back to where you got them done, or how did that work?
Well, the interesting part about that case is that he and his wife moved to Dubai. So I'm thinking that he
Oh, okay.
got it done in Dubai. I never had to do it. But I was assembling a team of people that was going to help us, because it was going to take like 3 or 4 of us, working
Mhm.
together. A couple of my specialist colleagues, we were going to work together and do this, and it was going to be a matter of retrieving all the implants and
Mhm.
but
Wow.
he never did it because he moved away.
Yeah. Well, since you brought up implants, I think I've heard that question a lot from people asking,
Yeah.
what is an implant? What's the process? How long does it take? I have an implant and I know it felt like it took forever. It felt like it took 40 years, but it was not that long. Maybe more like a year, 9 months. I don't know.
Maybe.
But can you talk about that process, like what that looks
Absolutely.
like?
So implant dentistry is not new technology. It's been around for quite a while. Dental implants are probably the 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 best way that we have right now to replace a missing tooth and keep it there for a long period of time. Okay. Um, when done properly, they last for a very long time. We have different ways that we do it, or different situations. We can, basically replace all the teeth, either upper arch, lower arch, or both. It's very popular these days that people will use implants to secure dentures in place and those types of appliances, or replace single teeth with implants. It's a great technology to have at our fingertips. And like I said, it allows people to have teeth replaced without necessarily having to take their teeth out and put them on a
Yeah.
countertop. So
Mhm.
that it's a wonderful adjunct to be able to provide that kind of treatment. Gratefully, it's becoming a lot more affordable. The implants themselves, there's lots of companies that make them now that are very good and predictable as far as longevity.
Mhm.
It's a great opportunity to be able to give people back their smiles.
Mhm. So what about because some a friend of mine, she had I guess a couple of implants as well, and we were talking. We were like, "What do we do with the flipper?" And I was like, "I'm keeping mine. I spent all this money on it. I don't know what I'm gonna do with it, but it's not, I'm not throwing it away." Can you
Right.
even tell people what a flipper is? I can't describe what it
Absolutely.
is.
Absolutely. So sometimes we'll make, and so a flipper is sort of like a slang term for a temporary partial, okay, that will sometimes make so that people, so it doesn't appear that there's a tooth missing, okay, and so it's used usually for a short period of time during the healing phase, and so you asked me time frame. It depends, kind of. There's the quality of the bone has to be good. The implant has to integrate into the bone. That usually takes about 12 to 16 weeks. So about
Mhm.
4 months on the longer side after the implant's placed. And then after that, the process to make it look like a tooth, goes pretty quickly. But that healing phase is very important. If we load the implant too soon, we risk failure.
Mhm. Yeah, I think I believe. Well, we had to extract my tooth first, so I had to heal from that, then go back, do a
Right.
bone graft, then heal from that. It just
Absolutely. And so
it was a
that
lot.
that process does take a little bit of time. And you're right,
Yeah.
it was probably about 8 months.
Yeah, it was a long time. And
Right.
I'm sure people could tell I had a flipper in because I could not talk with that thing in. And
But that
that's why
was
I'm just,
just for a period of
it,
time, Shamika.
it was
It's
just a short
beautiful
period of
now.
time. Yeah, it looks good now. Y'all make sure you drop your questions in the chat. So I am team implant. That's all I know.
Absolutely.
So what are some of the potential, let me go back. because maybe people get confused about the difference between crowns and veneers. What is the difference?
Okay,
Let's
so
start there.
let me just, a crown is covering for a tooth, okay? And so is
Yeah.
a veneer, okay? The veneer just
Mhm.
doesn't cover the entire tooth, okay? Veneers have been around in dentistry for a long time. They are not new. I know on Instagram, it kind of looks like this is something new that we've been doing. It's not. We've been doing veneers for 30 years, okay?
Mhm.
The difference is now is that they're more popular. It's been popularized because you have, our celebrities talking about it.
Yeah.
Cardi B kind of made them famous a little bit. Instagram, you've got all of that. So I think that's wonderful when people come in and they ask me about it.
Mhm.
But veneers are recommended in some kind of specific cases. Okay. You can't do a veneer in every situation. Okay. I've got people who come in asking about veneers where they probably need something else. Okay.
Okay.
And so, but maybe a TikTok or an Instagram drove them in, and then I
Mhm.
get to educate them about what a veneer is and why it's not the treatment that they need. Okay. But a veneer is a little shell. It looks like a little fake fingernail that we bond to either the enamel or to the surface underneath the enamel. And it basically kind of becomes like it's bonded to the tooth. So it kind of becomes a part of the tooth. Okay.
Mhm.
And the difference between that and a crown is the crown covers the entire tooth. All
Mhm.
right.
That's interesting. So, what would be a case where someone could not get a like veneers? Like, what's the most
Well, there are
extreme? Like,
lots of them. There are lots of them. I mean, a veneer is not indicated to treat tooth decay.
okay.
It doesn't replace a missing tooth. Okay. You pretty
Mhm.
much need a relatively healthy tooth to put a veneer
Gotcha.
on. Okay. When I do veneers on patients, um, it's usually because they want to enhance their smiles. Maybe they've had bonding procedures in the past and it's,
Mhm.
just doesn't look good anymore, or it's discoloring. I've got patients who are in the public eye, maybe they're entertainers or politicians or whatever. And so they have to smile a lot. They get pictures taken. And so they want their smiles to, be very full, and they want to, have the confidence behind, having a nice smile. And like I said, in those situations, it's cosmetic. It's not to I mean, we can make the size of the teeth look better. It's kind of like any other enhancement, that
Mhm.
you might do to,
Yeah,
you know what I mean? Yeah.
I do. Yeah, yeah, yeah. So Michelle Shands wants to know, can a veneer help with tooth sensitivity?
um I don't, I would try to find the cause of the sensitivity before saying that
Okay.
you could get a veneer to correct that. Okay. Because if the tooth is sensitive, there is probably a reason that it's sensitive. So if it's
Mhm.
sensitive because there's decay or a crack, a veneer might not be indicated or fix that.
Gotcha. So what are those risks and downsides and of like you absolutely should not be doing this? Going, you see, you're scrolling social media and you're like, "Oh, there's a veneer tech in my city. Let me go." And then you find
Yeah.
out they're in their living room or garage and that's where they're doing all their, I don't know what it would be called, veneer teching. I don't know, but why
Yeah.
should people not be doing that? Going to get their teeth fixed in somebody's garage, living room, all the places they shouldn't.
Well, I realize that it might be, you know, something that sounds like it would be a fun thing to do, to go to some girl's, living room and,
Mhm.
get your teeth fixed, but I really don't think that's a great idea. It takes us years of training and practice to do these procedures. And then, like I said, i- the dentistry is, it it has to work in your mouth. You have to be able to eat. You have to be able to close your
Mhm.
teeth together. You have to
Mhm.
understand the science and the physiological, functional things that the teeth need to be able to work together. And
Right.
I don't know that somebody in their living room with inadequate light, inadequate hygiene. Do they have a autoclave in their kitchen? How are they cleaning their instruments? How are they cleaning anything that they're putting in your mouth? Those are all questions that I would ask. What's your sterilization procedure?
Mm-hmm.
Um, and what if something goes wrong? Then what?
Yeah.
How are you respecting the fact that these people have to eat, even if you can make something that looks good. My assistants are wonderfully trained. They
Mm-hmm.
could probably do a lot of what I do besides fix a problem. Do you know what I
Right.
mean? So I
Yeah.
can teach them how to do a lot of things, because they watch me every day do this
Mm-hmm.
stuff. And so I've taught them how to do a lot of things. But if there's a problem, then they might not be able to solve it. Okay. And
Right.
so that would be, and I'm sure dental assistants are some of the people who are doing some of these procedures. They might want to make some extra money, or maybe someone asked them, and they probably
Mm-hmm.
know how to do the procedure using, resin or whatever. But
Mm-hmm.
if there's something that happens that is unforeseen, they may not be able to solve it. Do you know what I mean?
Yeah, absolutely. It seems like we have a ton of questions in the chat. I'm like,
Wow.
do I go with my questions or go with the chat questions? Well, I'm gonna go between both. So we
Okay.
may be jumping topics a little bit, but I want to make sure I
Sure.
don't get everybody's question.
Okay.
So one question: are there any reliable resources to locate great dentists? Like, is there a website or something that people could to find in their city?
Um, yeah, absolutely. We have, with social media these days, you can find a lot of different things. And like I said, if you look up, like, a lot of people tell me when they find us by looking at black dentists
Yeah.
or black women dentists in my area. And so
Mhm.
we show up and, and they check out our website, they check, they might call the office. And like I said, I think it's a great idea to look at people that you trust. Okay.
Yeah.
That's kind of tried and true. You talk to people, like I said, where you work or wherever, and sometimes you have to interview people just like you maybe try other things. You might want to come in for, I get people who come in for a consultation all the time. And, we don't charge for consultations. We'll talk about what your questions might be. Of course, if we do an examination, if I put some gloves on, then that's something different. But,
Mhm.
we can talk for 15 minutes about, what you might be interested in, and you can kind of fill us out. We don't typically charge anybody for that. But we spend so much time on that comprehensive exam. That's like an hour and a half of time where we go over everything in a patient's mouth and put together a detailed plan and a way to get it all fixed. So, that's a little bit more time consuming.
Okay. Penny Doster wants to know, can your mouth tell you if there's an illness within your body? Which is a great question because I was going to ask that myself.
Yeah, yeah. So we say that the mouth is the gateway to the body. And many times people have illnesses that we can find in the mouth. And I also want to stress um, there are some things that happen in the mouth that are unique to the mouth too. Cancer, oral cancer, is a very real situation um, in our population, and it's not just if you've been a smoker or a drinker your whole life. I have a patient that I care a lot about. I've been seeing her for a very long time, and she was diagnosed with oral cancer just this last year, and
Mhm.
she had no pre-existing um like lifestyle concerns. But we check all of our patients every single time they come in for cancer, and caught it early. Thankfully, she's recovering and everything. But that's a very real situation. So cancer in the mouth is a big thing. Diabetes also, we see they can often diagnose diabetes by looking in the patient's mouth because their gum
Wow.
tissue. Yeah, exactly. So a lot of times we'll, tell patients, hey, you should probably go and check your, get your blood glucose checked out, get your A1C checked out.
Mhm.
Sometimes having blood sugar that's out of control, people might know they're diabetic, but they may not be checking their blood glucose levels regularly, and we can often
Mhm.
tell that by looking in their mouths.
Yeah, I'm sure acid reflux you could probably tell as well.
Acid
And
reflux,
yeah,
absolutely.
that's another one.
Patients that have acid reflux, we've been able to help a lot of people
Mhm.
by helping them get that taken care of as well, because the teeth just look different.
Yeah, yeah. So Tommy Rhymes has a question. We have the same last name. Shocking. Can you lighten or can you light? I'm reading it off my phone because yeah. Okay. So can you lighten or darken partial teeth? So a
Mm,
partial, the teeth on the partial, can you lighten or darken those?
no, it would probably have to be replaced.
Okay. Okay. All right. Let's see. We've got Lynette McCallum wants to know, does using mouthwash really make a difference?
Well, what are we rinsing with? What kind of mouthwash? I mean, I guess it depends on the mouthwash that we're using. There are some mouthwashes out now that are really good, that we recommend in our practice, that are great for lowering the bacterial count in the mouth. Because I think a lot of times people just want to rinse to make their mouths feel minty.
Yeah.
But a mouthwash can be protective. Sometimes it has cavity prevention. Um,
Mhm.
uh, um, for that, we have rinses that are good for cavity prevention, some that are good for lowering the bacteria count in the mouth. So I think they can be helpful, but it depends on what rinse you're using.
Okay. Deidre Anderson wants to know, is Invisalign better than braces? Are y'all related?
That's my sister.
My sister.
Well, Invisalign and braces accomplish the same thing. Um, there are some situations where I definitely think that traditional orthodontic treatment might be indicated versus Invisalign. But Invisalign is an amazing product. We've been using Invisalign in our practice for over 20 years. And it has the technology now is amazing. There are so many dental issues that we can correct just using Invisalign. I mean, it sometimes even surprises me what we can really do with using those clear plastic aligners. A lot of times people are like, wow, is this gonna, do anything for my teeth? But the technology is so good right now that most of the issues that traditional braces can correct, we can
Mhm.
also do the same correction with Invisalign.
Okay. I know because I put it on the flyer earlier, but the Snap-on Smiles, can you explain what
Yes.
that is and when you would use that?
Yeah, so Snap-on Smiles have been around for a long time too. Um, what it was originally marketed for is when people wanted to say you had an event to go to,
Mhm.
but your smile was less than ideal. Okay,
Okay.
so you would have this um, uh, like a mouthpiece made, and it looks like we shade it so that all the teeth look nice and white and bright and everything, according to what your skin tone is. And you could wear it if you were like going out, or if you're going to be on TV or something like that. I've had a few patients who've requested them because they didn't like the way their smiles looked on camera. And so, they're more of event type situations. They are
Gotcha.
not designed for you to go out on a date eating the whole dinner. I mean, that's not what they're for. They're really just for looks. Okay.
Okay.
Unfortunately, sometimes people get them and they want to wear them all of the time. Okay. That's not what they're designed for. Okay.
Mhm.
So, and that those two have been around for a very long time.
So what about when people are wearing, I think they call them grills in their
Right.
mouths, and then they
So,
don't take them out. They just wear them all the time.
exactly. Exactly. And so I get, people want to have, bling in their mouths. I mean, you see a lot of the athletes and, some rappers and, and actors and actresses, people want to have, shiny, my suggestion, if you want to do some art in your mouth, please don't go to a jeweler, go to a dentist. I mean, I've got some colleagues that are doing some beautiful things with doing some artistry in people's mouths, but it's not designed for you to wear it all the time and eating your meals and everything. You've got to take them out. You have to brush and floss your teeth and get regular dental care. Okay. And I'm not opposed to it, but I just think that if you're going to do it the right way. Like I said, just go into your neighborhood jeweler. And then, once again, the sterilization techniques.
Right. Yeah.
I don't think that they're doing that. Okay. At least not to the level that it should be done. Okay. And there are, I know in Atlanta, there's lots of places that you can go. Like I said, I don't know how people are sterilizing these things and how they're, you can't put something in somebody's mouth and then put that same thing in somebody else's mouth without it going through a steam heat procedure. Okay. When we autoclave or clean our instruments, they go through a whole system of cleaning before we use it on anybody else. So I can't really see how people are doing that.
Okay. I remember randomly meeting someone and she had a diamond in her tooth and she said she had just gotten divorced and she took the ring and wanted the diamond put in her tooth. And I was like, now how?
Yeah.
I guess you have to go to a special dentist for that.
Well, there are some people who are doing that on the, in their living rooms or whatever.
Yeah.
They put a little diamond on their tooth or whatever. And, it's cute, I get it. People want to have a little bit of a, when they smile, they want to, have some decoration. But yeah, once again, I would want to make sure that anything that somebody is putting in my body has been properly maintained and cleaned.
Okay. Let's see. We have more audience questions. My co-hosts are popping today. Let's see. What's the best way to take care of a cavity besides brushing 3 times a day? I think maybe prevent a cavity.
Cavities, cavity prevention. Yeah, absolutely. So I know we haven't talked about this yet, but fluoride is kind of a big deal right now. There's lots of talk about taking the fluoride out of the water. People ask me all the time about, should I use a fluoride toothpaste or not use a fluoride toothpaste? So what we know as far as what the research tells is that, at the heart of this, I'm a scientist. Okay. people who use a fluoride toothpaste have a lower rate of decay than people that don't. Okay. So I've had a few patients who've said, I'm going to stop using fluoride. I'm only going to use natural toothpaste with no fluoride in it. They usually end up getting tooth decay. And so they'll go back to using their fluoride toothpaste. I've had several patients who, we try to, all I can do is educate you about what I see, every day, and there are some dentists who, claim that, they do holistic dentistry and that they can do cavity prevention without fluoride. I haven't seen it, and we got to have some evidence, all I can tell you is what works, and, I've been doing this now for about 30 years and I've seen a lot of different things. And when I see people who don't have cavity protection, they have cavities. I don't know. And I guess if you're not going to use fluoride, then you really have to be very strict about what you're drinking. We have a multitude of choices of what to drink, and everything that you buy at the store that's not water has sugar in it. And even if you are drinking sugar-free soda, it's still acidic. Decay thrives in an acidic environment. And so drinking your diet soda is not enough it's not
Right.
enough. Okay.
Mhm.
Juice, unless you're juicing it yourself and not adding sugar in it, it has sugar in it. And it can destroy teeth. And I see it a lot with kids. We see children who still have rampant decay because parents sometimes think that kids can drink the same things that they drink, and they just can't. Even
Mhm.
adults shouldn't be drinking it. Soda is not, or pop for my homies in Michigan,
Yeah.
it's not, it's not a food group. There's nothing healthy that's in soda, nothing. So I advise, parents, don't give your children soda. They shouldn't be, you shouldn't be drinking it either. If you're going to drink juice, dilute it. And juice is not a food group. Apple juice is not a food group. The apple is, but
Mhm.
the juice isn't. An orange is a fruit, but the orange juice is not.
So I should probably pour out my pineapple juice.
Well, I'm not going to say don't pour it out, but just drink it. If you're going to drink juice, you have to be
Yeah.
strategic about when you drink it. So you drink it with a meal. That's
Mhm.
when your saliva is
Yeah.
the most protective. Okay. So
Mhm.
if you're going to have a soft drink, you need to drink it with a meal. People, I tease my patients all the time how I see them driving around with their big cups of sweetened tea, because that's what we drink
Oh,
down here.
yeah.
And so it's not good to drive around all day in your car sipping on it. If you're going to
Yeah.
drink it, then just drink it. But
Mhm.
to sip on a sugary beverage all day is inviting tooth decay.
Well, there's another question that is asking about, can you get tooth decay at the top of your tooth near the gum line, and what to do about that?
Absolutely. You can get decay on any surface of the tooth.
Mhm.
And if you're getting decay at the gum line, then you really need to come in and see a dentist.
Mhm. Let's see. This is a good question because I've seen this a lot. What are tonsil stones and what causes them? Good question, Deanna.
Yeah, yeah. So tonsil stones are calcifications in the tonsils. So if you have tonsils, what happens is, or what they're for, is to basically catch anything that it should not be going down your throat. Okay.
Mhm.
And so our tonsils kind of act as a filter. That's probably the word, a good word for it. And so those stones happen when the tonsils are working. They're doing their job. Sometimes people get them. All right.
Yeah.
So there's not a lot that we can do to prevent them. All right. Um, but when I have patients come in, I had a lady just the other day, she came in, and, I told her, if you want me, if you see them, and if I can see it, I've got a little instrument that I can sometimes, like spray it out. It's
Uh-huh.
not the most comfortable thing, but, if it's bothering you, we can do that. The ear, nose, and throat doctors really don't have a great solution for it.
Mhm.
Rinsing really well, like if you can get your mouth rinse to the back of your throat and kind of gargle it up, that's also a
Mhm.
good way to do it. But I've popped them out before. My husband used to get them too, and I would, get them over at the office and basically, traumatize them a little bit, probably.
Or
But
get
I
back at
think
him.
exactly. But I think a lot of times people, they feel like maybe their breath isn't as fresh because, like you said, it's bacteria that sometimes it gets calcified, and it
Mhm.
sometimes can have a foul odor.
Okay. Let's see what else we got here. Your sister wants to know, how do you feel about using dental students to save on cost?
So dental schools are a fabulous way to get your dentistry done, um, cheaper, but it
Mhm.
sometimes takes a little longer.
Okay.
But they have
Okay.
oversight at dental schools. There's instructors there. It's a great way to support the school too.
Mhm.
So I believe in going to get dentistry at the dental school, especially with finance. If financing is if you, because costs are pretty, are not even comparable to private practice. So, but it does take longer. You got to have time.
Right. It's kind of like hair school. If you go to hair school,
Yeah.
you're going to be there
Yeah.
a while.
You're going to be there for a while because they have to check every step. But it's a great way to get your dentistry done if you live near a dental school and you have the time.
Okay, Linda Young, which is also my mother, she's wanting to know, is is gum cancer hereditary? Or oral cancer, I think is what
Oral
she's asking.
cancer. I haven't seen any research to say that it is hereditary, but there are probably things that are familial. I think my light just went out. That are familial, that can maybe cause it to be generational.
Okay.
How if you kind of do the same things that your parents did.
Yeah.
So if your parents were smoking and maybe, because, smoking we know leads to cancer. It can. So if you're a smoker and you've been a long time smoker, maybe abusing alcohol too, those two things in combination seem to be one of the predisposing factors for oral cancer.
Okay. Gosh, we're running out of time, y'all. So we got time for maybe one more question. I'm going to ask a question while y'all type real quick. But night guards, like why are they so important? And should you buy them over the counter or go to the dentist and get one specially made for your mouth?
There are some patients that I prefer that I'm in control of the night guard. So there are occlusal guards. Of course, we call it a night guard because we recommend that people wear them at night. Okay. So it's actually it's an occlusal guard. It's to protect the teeth. Now, if I have a patient who's made a significant investment in their mouth, say we've done lots of veneers or crowns and they happen to be, they grind their teeth and we want to just protect the dental work, then I would suggest that we make a custom occlusal guard for them that I adjust as needed and I make sure that it fits properly. When you buy the over the counter, then you're making it at home, you're putting it in some hot water, biting it into, it is what it is, in some situations, where people, just are using it for a short period of time, maybe, or if they haven't had a lot of dental work, kind of like in the situation where I'm talking about, or if the patient is a grinder and they're having muscular issues, then I like to do it myself. Okay. And I think most dentists would feel that way. But for someone who's just, if they're playing sports or something and they just want to have something to protect their teeth, then fine, if you want to get something over the counter. But if we're trying to protect an investment, I would suggest a custom made night guard.
Okay. I am one that has the custom made because I would take the over the counter ones and toss them right out of my mouth in the middle of the night.
Right.
Okay. Yeah. We got one more audience question. Deanna wants to know, can an underbite or overbite be corrected without braces?
Probably not. And I'm assuming what she's talking about is when the teeth either stick out too far or if the upper teeth are behind the lower teeth. Those are pretty challenging situations to correct. And and sometimes they need to be surgically corrected. So it's really hard to correct those issues without doing orthodontic issues, either braces and surgery or at least braces.
Okay. And I lied. One more audience question. Penny wants to know, does eating ice hurt your teeth? And I think that's for my low iron folks.
Yes, yes. Do not chew ice, ladies. No ice chewing. Get your hemoglobin checked and take an iron supplement.
As soon as I see somebody chewing some ice, I'm like, you iron low. I am one of the low iron girlies. So
yeah, take the supplement. Because if you come into the office and with a broken tooth, we're going to have you got to get that fixed.
Well, for my last question, that's so funny. Somebody said that that's what they're doing right now. Put that cup down.
I know. Put that cup down. Spit that ice out.
For my last question, I ask this of all my guests: what feeds your soul?
Oh my gosh. I am so blessed. I get to do something that I love. I've got amazing patients, amazing people I work with, and being able to help change people's lives. I mean, it's an amazing thing. I love it. I absolutely love it. And it lights me up being able to provide people with care. And we share a lot of things. Most of my patients know they know about my family, they know about my kid. They are super supportive. It's an amazing thing to have done this for so long. I'm so incredibly blessed. I see patients that I've watched them grow up, and now I see their kids. I mean, it's crazy. I just love it. I just so love it. And it's just amazing to be able to do something to help change people's lives, and it's not just about their smiles. Sometimes it's, giving people back their confidence, sometimes people have life changes. Sometimes they get divorced and they're, ready to go date again. They want to get their teeth fixed. I mean, it's just an amazing thing to be able to help people, do that. And then to be able to take people who were really afraid and, and have them not be afraid anymore. That's also very rewarding too, is that when we can overcome, anxiety and phobias and not have to use drugs necessarily to do it. I just, that feeds my soul. I love it.
Well, I love that. Well, tell everyone where they can find you, how they can reach out to Dasling Dentistry if they're local to the area, or maybe they're going to be in town and they're like, I want Dr. Anderson.
Or if they want to drive down here, we'll see them. So we have 2 locations. In Charlotte, we're at 8420 University Executive Park. It's Dasling Dentistry, Dasling Dentistry. And then we also have a location in Indian Land, Fort Mill area. We call it South Charlotte because it's sort of suburban to Charlotte. And that's Doby's Bridge Dentistry. Okay. And we're at 4174 Doby's Bridge Road, Suite 100. Which is where I'm at right now.
Thank you. Thank you so much, Dr. Anderson. This was so informative. And we didn't even get to all my questions, so you're going to have to come back at some point.
I'd be happy to. Yeah, we never got a chance to talk about kids. We got to talk about the babies.
Right. Yeah,
absolutely. We got to do that. Yeah, I'm willing whenever you want to, Shamika. It's been a pleasure.
Yeah, we'll have to definitely do part 2. So thank you to my co-hosts in the chat. You guys have been awesome tonight. I love all the questions. And for more information on oral hygiene and its connection to your overall health and just some tips that you need to follow to get your oral hygiene together, head over to blackdoctor.org for articles and resources over there. Next week, I will be introducing you to another thing to add to your wellness toolkit: healing through the sound of sound bath meditation. Let me know in the chat if you've ever done a sound bath meditation. And I will see you guys next Wednesday. I think it's next Wednesday, but have a soul-filled rest of the week. And I'll see you then. Bye. Dr. Anderson, don't hang up yet.